The first piece of information in the supervisor section is a week-by-week guide for the supervisor. So none of this is set in stone, but it is a suggestion to help guide the supervisor to bring you from your status as an observer to a therapist who is able to implement activities based on treatment plans that the SLP has provided to you. So typically in week 1, you will be oriented to your site. You'll learn about policies and procedures, and you'll find out where classrooms are if you're in a school setting, or client rooms if you're in some sort of a residential clinical setting. You'll find out where materials are kept. You'll learn kind of about how things are filed. You'll be reviewing the therapy session files as appropriate, and really observing your speech language pathology supervisor as they provide treatment. During that first week, hopefully you, along with your SLP supervisor, will select 2 or 3 starter groups or individuals for you to take over providing treatment. And then in week 2, you'll get started, probably maybe following your supervisor's treatment session plans and their material suggestions, and kind of go into week 3 then, building up your the number of clients that you are seeing and taking more responsibility for things like data collection, writing treatment session plans, selecting materials, and all of that. For me personally, I believe that if you are a successful student in fieldwork, by the end of your fieldwork placement, you should be pretty independent, writing treatment session plans based on the treatment plan, overall treatment plan that the SLP has developed. You should be competent at collecting data for most types of disorders and therapy, providing feedback and all of that. The last paragraph has a listing of activities that are eligible to be counted as 100 hours of experience, and then a reminder that at least 80 of your required 100 hours of experience need to be providing direct therapy services. The next item in the fieldwork packet is a sample letter to parents letting them know that some of their services for their student may be provided by a speech-language pathology assistant student. It is part of the roles and responsibilities of an SLPA and the guidelines for use of SLPA services that all clients, patients, and students be informed of the fact that services are being provided by an assistant. Most of your internship placements or fieldwork placements are in school settings, so that's why this is specific to a school setting. If somebody is in a clinical placement and the supervising SLP asks us to draft a similar letter for that placement, we will certainly do that. But this one is the one that is used most often. Sometimes your fieldwork supervisor will use this letter and just fill in the blanks. Other times they choose to write their own letter. I should clarify too that you have an assignment in this course to write a letter for parents about the services of an SLPA. Do not use this letter as a copy or as a template to copy, and do not rewrite this letter with your own name on it. This letter informs parents that services are being provided by a student, and it will absolutely not meet the requirements of that assignment, so just be careful with that. This form is not required to be filled out, but is a tool that your supervising speech-language pathologist might choose to use to provide you with some more structured feedback about how you are doing providing therapy. So it has a rating scale for a variety of skills that are part of your SLPA scope of practice and an area for comments. Notice that it also has a student and supervisor signature section, and this is included because sometimes things start to go amiss in a fieldwork placement. Your supervisor might need it to document feedback and problem solving that you guys have been trying to do to sort of get back on the right path. Other times, some supervisors just like to have documented feedback for their own purposes, and they might ask you to review it with them and sign it, and that is perfectly acceptable. This evaluation form is built out in Trajexis, and so your site supervising SLP will actually complete this form and review it with you in Trajexis, but we provide this hard copy to the supervising SLP so that they have something that they can look at as they maybe observe and consider what rating they want to provide for your fieldwork experience. Some of these things are not showing up exactly correctly on the screen here, but it'll be fine once you get your printed materials. Anyway, this comes directly from that verification of technical proficiency of a speech-language pathology assistant that you have used in your SLPA 101 course and are studying again in your SLPA 235 course. We have interpersonal skills, professionalism, technical skills, and screening skills. And your supervising SLP will give you a numerical rating that will allow them to rate you in one of these categories or an area in between them, and they can also mark things not applicable. Now, one thing that's important for you to know is that that is going to convert to a numerical score, which then will go into my MTI as a grade for you. Do not get overly worried about the grade on there. We have a wide variety of rating styles in speech-language pathologists. Some SLPs feel that if you're doing what they expect you to do, they're going to give you a MET rating, kind of a middle of the road, and your letter grade in my MTI is going to look low for that that midterm or final evaluation. Other SLPs think if you're doing what they expect you to do, that they're going to give you the highest mark possible, and they will mark exceeds expectations. So because we don't have consistency in rating between speech-language pathology supervisors, you will see that your midterm and final evaluations do not make or break your grade in the course. So I just want to make sure that you are, kind of talk yourself down off the ledge if that letter grade that shows up from your midterm or your final evaluation isn't what you might hope it would be. The final form for your fieldwork supervisor is your statement of hours completed. So this form absolutely must be filled out and submitted by your supervising SLP. You will obviously participate in the completion of this form by going into Trajexis and finding your hours of supervised clinical experience and providing that information to the fieldwork supervisor. But this verifies that you have completed at least 100 hours of fieldwork experience and at least 80 hours of direct client contact, if indeed that is what has happened. So it needs to be completed by the fieldwork supervisor and then sent to either Deb Flynn or me at MTI. By them. So don't say, oh, I'm going to, the continuing education day and I can just give it to Jennifer, because I will not accept it from you. It needs to come from your fieldwork supervisor.